We're starting a new series this morning about the health consequences of putting off care due to the pandemic. I'm joined now by Dr. Joe Vasile from the Greater Rochester Independent Practice Association about the overall public health risks of skipping preventative care. Dr. Vasile, did I say your last name correctly, first and foremost?
Vasile, pretty close though. Thank you.
Okay, I was giving you like that Russian accent at the end. How about that?
Great.
Thanks so much for joining us this morning. How are you?
Good, good. It's a pleasure to be here.
Yeah, you know, for a while it felt like any non-emergency care was shut down almost completely, and so we didn't really have a feeling of what was accessible for preventative care and what was accessible. I know things have reopened a bit now, so talk us through, you know, what it was like those few months where things were kind of in limbo, and what people can expect now when they go into the doctor's office.
Sure. It's a pleasure to talk about healthcare today, but not the COVID kind, but good old-fashioned blocking and tackling, and that's preventive health care and routine care. GRIPA is part of the Rochester Regional Health System, and our focus, like many others throughout the healthcare system, is to make sure that people get good, solid care. And that's really, there's a lot of people that aren't getting care. A recent national survey was just published that showed that up to 50% of everyone in the country has either delayed care or has a family member that has delayed care. And that's very concerning because there's lots of things that are still going on within a population that need to be attended to. So some examples include things like mammography or colonoscopies to detect cancer. We want to make sure that we catch other illnesses in their very early stages as well. Things like hypertension and diabetes need to be cared for, and you need to visit your provider to make sure that you are staying up to date with your medications and the best care possible.
You know, I know we mentioned, Dr. Vasile, that this isn't pandemic related, or at least we're not talking about the coronavirus. We're talking about all the other issues that can come up year-round, no matter what time of the year it is or when it is. But I think we've seen in this pandemic how important it is to take care of yourself and to make sure that you're giving your body the fighting chance that it needs to fight off any potential virus, right?
Absolutely correct. Like everything else, healthcare has been greatly affected, not only in the care delivery end of fighting the virus, but like we're talking about today, people putting care off and things slowing down. Things like, let me go on, baby checks and child checks, where kids get vaccinated against other routine illness. We're entering the flu season, so we don't want to see a decrease in the number of flu shots that people get. And then certainly there's the whole area of mental health, where people need to take care of themselves throughout all of this and their loved ones.
How important is telehealth for preventative care? You mentioned mental health. I know a lot of therapists have been seeing their patients via telehealth. How important is telehealth right now?
Telehealth is becoming a huge part of how we deliver care. It's you know, many people have concerns about going to providers' offices or hospitals, and telehealth provides a great option. Increasingly, our providers, our physicians, and other advanced practice practitioners are getting very, very comfortable with the technology, as are our patients and people from the young to the very, very old. Are embracing telehealth, so it's a great option for people to continue to update their care.
But some things just need in-office treatment, and so that's where you guys are encouraging. Doctors are saying, go ahead, come back to the in-office. We can treat you there and prevent any future more serious things from happening.
Yep. If people need to come into the hospital or into their provider's offices, I would encourage them to do so. All the appropriate precautions are being done, and they are safe environments.
Good reminders this morning. Thank you, Dr. Vasile. We appreciate it.
Okay, thank you.